Hi, I'm Dr. Cheyenne Dudenhoeffer. I'm a family medicine physician at MU Healthcare. In my medical practice, the thing I find most rewarding is really the connections I get to make with patients and getting to see them through really low times and really high times and getting to celebrate their victories and getting to know people over the course of a long period of time. And I think that's why family medicine's been a really good fit. I think that continuous learning as a doctor is really important, and one of the big reasons I decided to stay in an academic institution, I think getting to teach residents and medical students helps me to learn too and kind of stay sharp and on top of my game. I think the biggest thing is really thinking about the patient not just as a medical diagnosis, but taking the time to understand what other factors influence maybe what's going on. What does their social life look like? What does their home life look like? What access do they have to certain things? And finding a way to make a treatment plan work within the confines of all of those things. I am married, have a little dog. We love to hang out with friends. We love to go to Chiefs football games, so we do that pretty much every year. And then whenever I do have some downtime, I like to read a good book and mostly spend time with my family. I think people should come to MU Healthcare for their care because we have such a broad range of specialties, and we also have a broad ability to have lots of learners that are involved and lots of residents that are involved. And the more people that tend to be involved in your care, the more likelihood that, we're going to find the thing that we need to, or that piece of the puzzle that maybe was missing. MU Healthcare having the rural clinics in multiple locations is super important. I grew up in a small town that we didn't have access to that. And so the closest place that you could go was all close to an hour away. And so being able to provide access to people in those communities is super important because the access allows for healthier communities overall.